flavor for your ear. Epic Spotlight. Putting the spotlight on positive goings on the real people that have chosen a real path. The who's, the whys, and the hows are being shared and given to you.
All right, we got another one. But before we get going, first got to take care of some housekeeping notes. This episode today is sponsored by Epic Mortgage. Whether you're buying, refinancing, or investing, call Epic today at 708-905-5300 at 708-905-5300. It's your dreams, your goals. Let's plan together. Now on with the show. Today we have Dr. Matt Glowiak. He is a clinical faculty in the Southern New Hampshire University, also Yorkville University. He has a master's in mental health counseling. As an individual who is passionate about everything mental health, he has a diverse background in higher education, private practice, addiction, servant leadership, presenting, publishing, and advocacy work. Dr. Glowiak has worked with many clients diagnosed with a variety of conditions, as well as those aiming to increase their overall well-being. Welcome, Dr. Matt.
Well, thank you, Dante. And let me begin by saying, in terms of dreams and goals, you were one who helped my family achieve a huge dream and goal of ours with their very first house on the east side of Bolingbrook, Illinois. Remember that being a very difficult time for us financially at the time, but we were excited. Starting our family, my wife was pregnant with our first child, Matthew Jr., and was just starting my first professor gig at Benedictine University. And there were a lot of closed doors for us at the time in terms of finding a house, and you helped us find our first family home. So I'm ever so appreciative of you. And I really love everything that I'm seeing you do on social media in terms of the ways that you're supporting families, providing financial advice, and just helping make the American dream come true. You are amazing. And I wanted to make sure that I started off with that. So my gratitude to you, and thank you for having me here. But in short, yes, things are going well. Thank you.
Well, I did not pay you for that. So thank you so much
No,
for
you
those
did
kind
not.
words.
Not at all.
No, that was awesome. No, thank you so much. It's always a blessing getting introduced to people. And, obviously, if that's your goal, if that's your dream, I just tried to do my part. And I was glad and happy and, relieved that we were able to get it done for you and your family. And just to see what you've been doing is quite amazing. So, yeah, no, I would say so. So, no, as far as, your research and your writing, into mental health, can you kind of, give us a little tidbit of like, what would we see in all the writing?
Yeah, so there's certainly a mix of good as well as a mix of bad. And we've seen a lot of changes ever since the COVID-19 pandemic that we've been struggling with here. Throughout that time, we've seen an increase in many mental health disorders. Individuals who've never experienced major depressive disorder started experiencing that for the first time. Generalized anxieties. There's a lot of fear of the unknown. What's going to happen out of this pandemic? We've seen a lot of grief and loss. Many individuals lost family members due specifically to COVID-19, lost family members specific to other types of diseases, disorders, and so on. And what was especially painful during that time was with all the physical quarantine that we had, people experienced social isolation, were unable to visit sick loved ones, unable to hold or attend different wake and funeral type of services. So what we've seen for the first time in history is actually grieving, which is a natural process. We've started talking about prolonged grief disorder. We talk about ambiguous grief. And this is something new that we're actually classifying as a mental health disorder. Kind of interesting type of stuff. In terms of substance use disorders, addiction specifically, we've seen some increases there. For individuals who may not have had an issue with alcohol and drugs before while working from home, started off perhaps with a liquid lunch, drinking throughout the day during work, and that escalated to morning, noon, and night type of use with individuals, particularly couples, families being in close proximity throughout the day and not really feeling an escape. We've seen increases in domestic violence rates. And so if we had an individual who never experienced a mental health disorder, many of them started to as they were struggling, and a lot of unknown because you haven't had this before. You don't necessarily know what's going on. And then for those who did have diagnosable conditions and were receiving treatment or perhaps even not, we saw these disorders exacerbate. They got a lot worse over the time. So that was a huge problem that we really had to face. And again, with the physical restrictions, the quarantine and so on, we saw a lot of mental health offices essentially have to close their doors during the time. And that opened up the floodgates for telemental health. So now we see a lot more providers offering phone sessions, doing different types of virtual sessions, similar to Zoom, but we make sure they're HIPAA compliant and so on to be able to continue providing therapy. So it was a very difficult time for a lot of people, and even going all the way down to the worst case scenario, suicidal ideation, suicide attempts, successful suicide. We've seen those increase as well, which is why we've seen, a lot of talk about the 988 emergency suicide hotline that we have. So a lot of bad stuff. But there was also some silver lining throughout this time. The silver lining is that because so many people were struggling with mental health and addictive disorders, we noticed that it's become a public topic of conversation. And that's been the issue for so long. There's been a lot of stigma around mental health and addictive disorders because a lot of people, when they're experiencing something challenging, they internalize it. Maybe they're experiencing shame, maybe they're in denial, maybe they feel as though there's something wrong with them personally. It's not necessarily a condition. So it's a thing a lot of people aren't talking about because they don't want to feel less than. But now, through the pandemic, we've seen a lot more people talking about it. Celebrities are talking about it, in terms of musicians. We see athletes talking about it. We see more commercials on television. We see more promotions for mental health services, and especially when we're taking a look at social media. And one of the things I've liked, which I think is a forward progression, is that when it comes to the stigma of mental health and addictive disorders, a lot of people envision the worst case scenario. They're thinking about the person who's struggling with a schizophrenia spectrum and is going to have a psychotic break at any time. Maybe we're thinking about somebody who's the sociopath, the serial killer, somebody who's engaging in antisocial behavior. And while these individuals do exist, the reality is that people who are struggling with mental health, they look just like you and me. They're functioning seemingly like anybody else. So the face of mental health isn't necessarily the clearest thing in the world. So, one thing I did recently for the Illinois Mental Health Counseling Association is that we went through some TikTok videos and we were speaking to what was a realistic interpretation of mental health versus an unrealistic one. And a lot of the ones that were most realistic were ones where people were wearing a smile on their face, but they were struggling internally. Or during a previous podcast about a month or two ago that I did, I was asked the question point blank, how can you tell if one of your clients is under the influence when they come to see you in session? I was like, well, they have a moderate to severe substance use disorder and they're at the point of using just to feel normal. They're going to look just like anybody else. They're going to use, they come in, they appear, bright-eyed, bushy-tailed, as you say it. It's when they're experiencing the withdrawal, when they're experiencing the cravings, that type of thing is really when I'm going to see the agitation. So they're looking like everybody else. So I'm glad that we're having this conversation a lot more. And that makes a big difference because as we do that, more services can come into place. But as we know, the need for services outweighs the resources that are out there available. So there's been major pushes, through legislation. A really great one I appreciate in the state of Illinois is since 2019, they did pass legislation to grandfather in mental health and substance use services for individuals who are struggling in that front with various forms of managed care and so on, because it wasn't that long ago that they would reject these types of services, especially when it came to addiction. They would reject these services continually, or they would limit them significantly to where people couldn't get what they need, but now they're starting to get the support. So we do see an increase of the disorders, but at the same time, we're starting to see more people providing the services. We have more access to services. Telemental health is made a lot more accessible, and legislation in many respects is starting to follow, which is a good thing. But we still have an uphill battle.
No, definitely uphill battle. And I appreciate you coming in here and talking about this because it is important. I mean, I think we all have a certain level of stress levels and anxiety, and it has probably risen, due to inflation and the pandemic, and the pandemic is going to be everlasting. A lot of people want to just quickly say, hey, that was 4 years ago, let's move on. But that's ongoing. The damage and just some of the rifts that has been created because of the pandemic, it'll be forever in our lives.
Well, that's what we got to think about too. I mean, individuals, human beings, let's think about it. We're social creatures. We're not meant to exist in an isolated type of vacuum. I mean, while some people might choose to isolate themselves, really, we're interpersonal beings. We rely on one another. And when we think about it, some of our main drives toward life collectively, when we look at this universally, we strive toward love. We strive toward a sense of community. We strive toward having that sense of belonging and task mastery. When you remove that from people, there certainly is going to be some mental unrest, and it might not necessarily manifest into a diagnosable condition, but you're certainly not going to feel good about that, having that isolation. And a big problem too that we see, and I think that we oftentimes minimize because, oh, they're kids, they'll be resilient, they can move forward. But think about all those elementary, middle, and high school students, who are going through, emotional development, learning development, social development, physical development. And that's stymied greatly by having these physical isolations that we have, the social distancing and so on. So a lot of them were missing out on prime opportunities to socialize with peers, play on the playground. As you get older, you're missing the opportunity to be on a sports team or part of an academic club. Toward the end of school, you're missing out on that spring break. You're missing your homecoming dance, your prom dance. You're missing all these huge events that were ever so important, graduation. And, so there certainly is some regret there. Some people are feeling jaded by it. And some people are really lacking the social skills to be able to move forward in life. And even think about those transitioning into university, having to opt for online options when maybe that wasn't the best fit for them. So we cannot minimize this experience, especially with that many years of it having taken place. The trickle effect is ongoing. And even, still, there's a lot of unknowns. I mean, how many mutations have we seen of COVID-19? It's always coming up and down, especially as we go into the fall and the winter. There's new strains of it. People are in closer proximity indoors. We don't know. I mean, that's the reality. And fear of the unknown is one of the greatest fears of the human existence. We have to keep that in mind.
Yeah, no, well said. Obviously, being an 80s baby that I am, it was always, Rambo, Die Hard, be
Yes.
tough, and it really was kind of like your emotions, like control your emotions, don't let them out per se. So now, obviously, mental health and being able to talk it out, that's kind of different. That's a transition that I'm just not accustomed to. Can you kind of elaborate just on what is mental health that we need to be, what are some things we can do?
So some of the things that we could do, be real with yourself. There's this saying, it goes as such, the more aware you are of self, the more aware you become of others. And from there, that's where wisdom is ultimately cultivated and may flourish. And what it means is this: while there are a lot of individual differences, we all perceive and respond to the world differently. No two people who have ever existed, currently do, or will in the future will think and respond to the world in the same exact way. This does include identical twins. However, there are a lot of universals for people. They experience pain. People have wants and desires. And with all of that being said, a big part of this is really being aware of yourself. If something doesn't feel right, we need to acknowledge it sooner than later. Because when it comes to mental health and addictive disorders, keep in mind that a lot of these are pervasive, they're chronic. If they go untreated and you feed into it further, it's going to get worse over time. So one of the things I continually remind my clients, students, or just people in my everyday life, this is more of the law of diminishing effects, if you will. So instead of that saying, if you continue to do what you've always done, you'll continue to receive what you've always gotten. In this respect, if you continue to do what you've always done, things are going to get worse down the line. So we want to catch this as early as possible. So one, you're the first line of defense. Two, when it comes to loved ones, having that conversation with them. Hey, it seems as though you're struggling, or I notice that something is off. I'm here if you want to talk about it. I'm here to support you. We want to come from that supportive type of place. We don't want to force people, into treatment. We know people become resistant when they feel as though they don't have a choice. We don't want to go on the attack of people. You're doing all these bad things, this, that, and the other. You're terrible. Again, that type of thing is going to lead to people to back off. And we don't want to insist on a particular route to recovery for people, because this isn't a one-size-fits-all approach. We have many common treatments that we use, but it needs to be highly individualized. So, even as a clinician, I'm not thinking about what I read in the textbook or what worked for my other client. I mean, yeah, that informs the direction I'm going to initially go, but ultimately, I'm going to custom tailor it to you. And that's something that we really need to ensure that we're doing in life. Knowing yourself, supporting other people, and then from there, becoming educated on the topic, reading into particular mental health disorders, but don't self-diagnose. We don't really want to go down that line. They always talk about, oh, don't be the WebMD doctor to yourself and so on. No, I will say that there's a lot of great content out there. As a student, I was always told, go to .edu, .gov, .org websites, only read peer-reviewed journals. But the truth is, there's a lot of great content that's out there. I've written for Choosing Therapy, I've been in WebMD, Very Well Mind, all these different types of websites. They're medically reviewed, really great stuff. And a little bit ahead, I think, than some of the peer-reviewed traditional type of stuff we look at, so you can get good information, but you have to use that as a guide. It's a guide. It's not your diagnosis. So from there, when you become informed on a particular topic, that's when you want to make sure that you're reaching out for help. That's making a phone call to a local counseling clinic, speaking to a provider, seeing if you need assistance. And I think one of the big problems too that people don't necessarily think about is when it comes to the stigma, know that many of the mental health disorders, majority of them, vast majority of them, are curable. They're treatable and curable. Now, while there is a handful of them, or there are a handful of them that certainly are treatable but incurable, such as schizophrenia, spectrum, such as bipolar disorder, autism spectrum, and so on. There's so many things that we could do to help a person get to a better place. But a lot of these conditions with treatment, major depressive disorder, anxiety, PTSD, different things like that, can ultimately be cured. So I think there's a lot of fear going to a mental health professional that once I have this diagnosis, it stays with me for life, and then this is who I am. That's not necessarily the case. A lot of people come in, they have transitional types of problems, and they come in 6 months, a year, 2 years tops. They're good to go. They've learned a new way. They're thinking, feeling, behaving in a more appropriate manner. And that was the thing ultimately that helped them get to a better place. And here's something too to think about in the general numbers, global numbers. And again, this is statistics, so it can vary about 5% or so in either direction. But we say about 40% of individuals will experience a diagnosable mental health or addictive condition throughout the duration of their life. So about 40% of people. But again, of that 40% of people, a vast minority are ones who have one that's lifetime and incurable. And also to think about this, it is inevitable 100% of us will go through some type of life trauma, some type of crisis, some significant loss where we could use some additional support. And there's no honor lost with reaching out and doing that. So, we don't have to be like John McClane from Die Hard or be like, Indiana Jones in the Temple of Doom and just tough it out. With a little bit of support, we can get to a better place and be able to live a great life. And when we're feeling better, we interact with other people better. They feel better. We support one another. And this is how we ultimately build, thriving, flourishing types of communities of people. But it really has to begin with the awareness and having the conversation.
Now, and well said, well said. And I do remember Indiana Jones.
Yeah, I did. Hey, here's a trivia for you. Do you know what movie created the PG-13 rating?
It had to be Temple of Doom, right?
It was the Temple of Doom. Yes.
Yeah.
They remember being a youngster in the 80s. I'm like, how in the world could they show this mull around guy doing this? Well, I want to get graphic, but those of you who've seen the movie, you know what I'm talking about.
Yeah.
That was supposed to be a child's movie. And yeah, the parents weren't too happy, and hence the PG-13 rating. So
there you go. There you go. Yes. Yeah. I remember that. Cutting open the head. So yes.
Like something else.
That was crazy. Now, as far as like anxiety and some of the stuff you were saying, are coping mechanisms always medicated, or are there ways we can can we do this? Is it a chemical imbalance per se? Is mental health? I know that's always a topic where hey, maybe it's internal, maybe it's just a chemical imbalance, and if we medicate it, then we're fine. Is there some truth to that, or no?
Great question. And that was something you kind of jogged my memory there that I wanted to include earlier when you're asking me about general trends. So one of the things about people, keep in mind that we are hardwired to feel good. We have our reward system in the brain. This is something that helps keep us healthy, for the most part throughout time, because you feel good when you eat, you're nourished, you feel good, you want to eat more. And that's really the way that this works. However, when it does come to addiction, a lot of people use drugs, they feel good, it helps them cope. So then they end up using more. And then ultimately over time, they can start to have this problem. So a lot of people are naturally wired to look for the quick fix. And then the problem when it comes to mental health, like the type of work I do with psychotherapy, talk therapy, if you will, is that it does take a while because you're learning a new way. Behavioral change does take time. You can't do it overnight. So when clients call me and they say, well, how many sessions is this going to take, Matt? I'm like, well, it's not about the number of sessions. It's about your progress and what you're going to ultimately put into it. And then seeing those outcomes are going to move forward. So we're wired for a quick fix. But when it comes to medication, one of the things that we really want to think about here is that with it, medication should be used as minimal of a dose for as short of a duration as possible to help an individual get to a better place. So, for a lot of individuals who are struggling with mental health and addictive disorders, if medication is prescribed, we want it to be for as short of a duration as possible. But even same thing, when it comes to other forms of care, like residential treatment, inpatient, if you will, we strive for the least restrictive, least invasive, type of therapy. So usually that's reserved for the more severe types of cases. Now, medication, in my professional opinion, as well as you can read in the literature, we do see is oftentimes overprescribed. Individuals will come in, will state what's going on. I don't feel good. Boom, here's a prescription. But then the problem is that they're starting to feel better, because the medication is working and it's, helping balance out the neurotransmitters in the brain, hormones in the gut. So you start to feel better. But the problem is the issue's still there. You're not working through the issue if you're not getting the other treatment too. So medication does work best in combination with the talk therapies. So if you have a prescription in psychotherapy, working on the problem while balancing out the chemical imbalance, you're going to start to feel better. Problems will start going away, titrate off your medication, then ultimately be in a better place and no longer needing the medication. Now, we have to keep in mind too that with mental health, we do take a biopsychosocial approach. And what this means, biology, physiology, what's going on inside a person chemically. We're all different chemically. I mean, there's a lot of similarities. We all have those individual differences. Psychology, your cognitions. What are your thoughts like? What are your emotions like? What are your behaviors like? And then we have the social, who's in your immediate environment, family members in your household, people in your community, your coworkers, people at school, community at large. All these combine to who we are, so there's also that genetic predisposition that we have to consider. So some people, when we see a life history or a lineage, throughout the family members who are carrying a particular trait, such as bipolar, schizophrenia, much more likely that you're going to end up with that diagnosis in life. But some people, if they have an appropriate upbringing, they might actually be able to evade that diagnosis because it never gets fully activated. So the upbringing has a lot to do with that too. But kind of long story short here, yes, there are chemical imbalances that people can naturally have that do require medication. Yes, there are things such as treatment-resistant depression, where that chemical imbalance, it's an organic chemical imbalance in the brain, you are going to need medication. Other conditions such as schizophrenia spectrum, yes. Bipolar, yes. And it just really kind of depends on some of the other conditions that you're going to see out there. So while majority of them do not require medication, and if you use it, it's more so a supplement to everything else, there is a small handful where you do need it. And in those cases, I strongly recommend it. And for example, if I had a client come into my practice who's diagnosed on the schizophrenia spectrum, the only way I can work with them in psychotherapy is if they are medicated. And I've worked with many individuals on the spectrum who are medicated, present just like you and I. You wouldn't even know that they have the condition. But I've also had individuals who came in without the medication, and pretty much no matter what I did, I was talking in circles and it wouldn't work. So it does depend.
No, thanks. I've always had that question, so I appreciate you answering that. Now, obviously, as an advocate for mental health, what changes and what progress do you like to see more of? What do you think is lacking in your space?
And there's a lot lacking, to be completely honest with you. Although I do find some of the legislation promising, like I said, with Illinois and grandfathering in mental health support services. This isn't true across the board, throughout the country. So we have an uphill battle there. I still think that a lot of individuals try to minimize mental health disorders, like they don't really exist. You're just being too sensitive, or not macho enough, that type of thing. We have a lot of stigma that's going on there. At a societal level, and we talk about, intergenerational trauma, we talk about oppression, institutionalized racism, and all those other types of isms, we have a social type of problem. And this is something that really disturbs me. How often do you have an individual who lives in a compromised community? Let's say you're living in poverty. There's a lot of violence, high rates of crime in the area. You're living in fear on a daily basis. You go into the school, it has resources that are outdated by like 20, 30 years. So your entire life is an uphill battle and you're struggling and you're acting out. And you don't really know where to go. And then you start to see a provider, and the provider gives you this diagnosis and puts all the blame on you. It's not on you. It's about society. We need to do a better job of not pathologizing people who are victims of society at large. So with that being said, we have an uphill battle in terms of what we need to do, and we need to really get on the same page in terms of, diversity, equity, and inclusion. That is a huge part of it. And while a lot of people might not see that directly tied into mental health, it's a huge part of it. And we're like really, really turning the blinders onto this. So I can't stress that part enough. Another piece is that we do have a lot of need that outweighs the resources that are out there. One of the problems, especially since the pandemic, when we're trying to allocate resources all these different directions, in our country, we're sending a lot of money overseas, we're spending a lot of money on this, that, and the other thing. That means that a lot of community organizations, these community mental health clinics and so on, they rely on federal grant funding. They rely on state grant funding. And if they're not showing the outcomes that the state or the nation are looking for, in that case, they might get shut down. They're not going to have the money to do it anymore. That's a major problem. Or when we have managed care that's saying, okay, you're limited to 10 sessions and the individual needs something that's more extensive, again, that is a major problem. But on the other downside of this is not all mental health providers are necessarily in it for the right reasons. They're corporations and businesses like anything else. Sometimes people just want to make the money. And one of the things that's really problematic is when we keep clients sick. The ultimate goal of counseling, the American Counseling Association Code of Ethics 2014, very first thing it says is that we're striving toward client autonomy. My role is to work with you to the extent that you get to your better place, you've learned the new way, you're functioning well, and then, okay, you're discharged. And however long that is however long it is, usually shorter than longer. And like I said, there are people who do need treatment for the duration of their life. But most people, it should be you're here for the duration of the condition, you're in a better place to move forward. But sometimes people try to extend that without any real purpose to doing that other than making additional money. Sometimes providers don't necessarily know what they're doing. And the good thing is nationally, we do have this accreditation, KCREP accreditation for mental health counselors. You got the American Psychological Association for psychologists. You have the National Association of Social Workers for social workers. We have all these types of governing bodies, but again, at the same time, not everybody's in it for the best intentions. Not everybody necessarily knows exactly what they're doing. And when people come into counseling for the first time, and you have a therapist who, is dismissive of you, sets a bad example, states a microaggression or is just blatantly discriminatory, pathologizes you for being in a difficult situation, it's caused by the environment. That type of stuff backfires. And not only is that client going to stop attending treatment, they're going to tell everyone in their social circle, don't go to this person, or actually don't even go to see a therapist because all they did was put me down further. And we're supposed to be a first line of defense, to help people maximize their experience of the human condition. So there's a lot that's going on. And also,
Yes.
clinical services, especially the good ones, can be pretty expensive, especially without managed care. It could be a lot, but I don't want to discourage people because there are a lot of great services that are free out there. Another silver lining of the pandemic, there are 24/7 addiction groups that run. You could do things like AANA. They have online groups for that now for free, which is great. Some communities have community mental health types of things that you can attend. National Alliance of Mental Illness constantly have open types of forums where people can go and attend that. So there are free resources out there that are helpful, maybe not as individualized as people would necessarily want, but it's still going to help you get to the right direction. So I encourage people to take advantage, but you can't take advantage if you don't know where they are. So we need to do a better job having conversations like this and putting it in front of people.
No, exactly. And that's why I brought you on. Great information today. You were amazing. Dr. Matt, where do they get a hold of you?
So you can easily get a hold of me at my Gmail address. So it's dr.mglowiak@gmail.com, dr.mglowiak@gmail.com. You can also find me Facebook public. I have a Mental Health Matters page. You can see me. I'm constantly posting articles, videos, excerpts from my books. You can also find me on LinkedIn. LinkedIn is a really great platform to find me. If you type in my name, Dr. Matthew Glowiak, you'll find tons of articles on choosing therapy. I write a lot on addiction. You'll find a lot of addiction articles, but also I write on a variety of different types of topics through different medias. I've been featured in Men's Health, Forbes, do a lot with WebMD, Very Well Mind, and so on. So if you type me in, you'll likely find something from me, and you can always reach out with follow-up questions. I'd be happy to respond.
Dr. Matt, I want you to have an epic day. Thank you so much. And this conversation to be continued.
Well, and thank you very much. And I am having an epic day. Thank you for the invitation here. It was truly a pleasure.
Take care.
You too.
The who's, the whys, and the hows are being shared and given to you. Epic Spotlight, baby. A new flavor.